Good afternoon. My name is Catherine Kelly, and welcome to the Master Plan for Aging, Mobilizing Your County and Community event, and Happy Older Americans Month. Again, my name is Catherine Kelly. I'm the Senior Government Affairs Manager with On Lok. And let's see, Lenore, I think I need you to unmute your line. The joy of Zoom, everyone.
Right. And hi, I'm Lenore McDonald. I cover government relations and community outreach for Center for Elders Independence. Together, On Lok and CEI represent the two Bay Area PACE programs, and we co-lead the Bay Area Health Policy Coalition. Since 2009, our coalition has brought together advocates, policymakers, and stakeholders at our biennial Senior Health Policy Forum, which is a one-day conference focusing on issues impacting the entire Bay Area aging population. This year's forum is going to take place on December 2nd.
Because they don't work.
But today, we're hosting an event specifically tailored for stakeholders in the North Bay. That would be Marin, Napa, Solano, and Sonoma counties, to talk about the local impact and opportunities for the state's new master plan for aging, which is designed to meet the needs of California's older adult population. Today's event is supported by a grant from the SCAN Foundation, whose mission is to advance a coordinated and easily navigated system of high quality services for older adults that preserve dignity and independence. And we all want that. Your participation today is one of more than 20 master plan events that will be taking place this year throughout California. We're so happy you're here, and we thank you for joining us.
Okay, there we go. Over the past 4 months, our dedicated 10-member planning committee, who represents seniors and adults with disabilities in Marin, Napa, Solano, and Sonoma counties, have volunteered their time to make today's program possible. We've listed their organizations here. Not only did the committee give their thoughtful time and input to shape today's program, including planning the breakout sessions that you'll participate in later today, and they also worked with elected officials to receive videos that we will view momentarily, but they also invited all of you. We are deeply appreciative of the planning committee's support. Thank you to each and every one of you. I also want to say thank you to the On Lok and CEI staff, in particular our IT support staff who are providing support in the background today.
So today's event will feature highlights from the state's master plan for aging and features 4 breakout sessions focused on 4 of the 5 master plan's bold goals: housing for all ages and stages, health reimagined, caregiving that works, and affordable aging and economic security. Now, our steering committee are choosing to incorporate the master plan's inclusion and equity goal during each of their sessions, rather than have it be a separate session. And we hope you too will consider the inclusion and equality lens as you participate in today's program. After the breakout sessions, we'll all come back together for a facilitated discussion on how we carry this work forward. We have some welcome videos to share with you today from some of our legislators, and we're honored to have received pre-recorded welcome message from Assembly Member Cecilia Aguiar-Curry. We truly appreciate the member support in helping to kick off today's event, and we're going to play that for you now.
Hi, I'm Assemblymember Cecilia Aguiar-Curry, and I want to thank you for the commitment to the health and well-being for older Californians. I am so pleased to see advocates, policymakers, and community leaders from North Bay counties, many in my district, joining together for this special session focused on the state's master plan for aging and its 5 bold goals. Like you, my team and I look forward to hearing participants' ideas for how to build on the master plan to make the North Bay a better and more equitable place to age. California's population is aging by 2030. To 10.8 million Californians will be an older adult, making up 1/4 of the state's population. I am proud to say I have worked with so many leaders in the senior community to craft legislation calling for the master plan on aging and to have a successful in driving home to the governor the importance of this issue. The master plan has given us a blueprint, and now it's up to us to build the systems that will allow people of all ages and abilities to thrive as we age. As community leaders, you know our county the best. Your involvement in its is critical to our success. So, as the chairman of the Assembly Local Government Committee and member of the Assembly Health Committee, I look forward to working with you as we advance solutions for our aging population. Thank you, and let's get to work.
Wonderful. Thank you so much, Assembly Member, for your kind words and for your support. I am honored now to introduce our first presenter. Debbie Toth is the President and CEO of Choice in Aging, serving Contra Costa, Napa, and Solano counties. Choice in Aging has been serving the community's frailest members for over 70 years. Debbie was appointed by the governor to the state's Master Plan for Aging Stakeholder Advisory Committee to shape this plan, which aims to serve seniors from all backgrounds in California. And Debbie, I will hand it to you.
Great, thank you. I just want to apologize in advance. I have child learner at home, so you may hear some background excitement. So when Catherine was talking about having to mute people for background noise, it might be me. Hopefully not. Hi, everyone. I'm so happy to see so many people engaged in shaping how we age and support aging in our communities. Now more than ever, we have reason for hope. Why? Because we're not the only folks recognizing the massively growing aging demographic, and it's no longer a bunch of folks saying the words silver tsunami. It's now a body of elected officials and department leaders that are creating legislation and re-envisioning how we deliver services. We are seeing all of the aforementioned folks celebrating the increasing diversity of our aging population and coming into a deep understanding of disability as a beautiful part of that diversity. Thanks to my partner in the disability world, Christina Mills, Executive Director of the California Foundation for Independent Living Centers, I now have the gift of understanding and internalizing that concept. I sincerely hope that you're able to get there too. So it's these numbers. So next slide. Thanks, Chelsea. Chelsea is our behind the scenes slide curator here. So I'll be talking to her as well. It's these numbers that you're looking at and this thinking that led our governor to call for a master plan for aging. And that's why you're listening to me today, frankly, because I had the honor of working alongside 34 experts in various places and spaces in aging and disability in crafting the initial draft of this plan. I'm going to get into the details of the final plan in just a moment, but I want to share a little bit first about why and how this plan came to be and why it's important. And I want you to just look at those statistics while I'm talking to you right now, because it's powerful. One, we've never had a governor elevate aging as a priority. In fact, in former Governor Jerry Brown's State of the State address, he talked about the burden of the aging population. He used the word burden when talking about the aging demographics. That gives that little flavor of the words silver tsunami when we talk about the aging population as a natural disaster. All of these bits and pieces of ageism that are baked into everything about our lived in world. So it's super important that we have this governor that has elevated this priority as a diversity and not as a burden. So that's one. Two is this plan, this master plan for aging, this blueprint for how we have a California where we all can age in community with dignity on our terms, with self-direction and all kinds of fun stuff that we all want for ourselves, for our friends, for our mothers, for our families, for our parents, everyone. So the second piece of why and how this all came to be and why it's important is that it was not just that there was this stakeholder advisory committee. There was a whole lot more that went into building this master plan. So there was a comprehensive outreach and input process that was led by the California Department of Aging and California Health and Human Services. So Marco Meach gets zero spotlight. This guy does a lot of work behind the scenes with the director of the Department of Aging, Kim McQuay-Wade. And together, they really did the heavy lifting of putting together the way in which we would be able to collect feedback. So there was a portal that was set up on the California Department of Aging's website. There were, sorry, I'm getting used to my tenses today, evidently. There were a variety of town hall meetings that happened first in person before we got sheltered in place, and then on Zoom, where local elected officials and area agencies on aging and service providers got together and collected feedback. That was all delivered to the California Department of Aging. And then there were webinar Wednesdays where there were different topic areas that were presented. There was a member of the Stakeholder Advisory Committee, there was a local area expert, and then there was a state cabinet level department person that was in on it. So the webinar Wednesday had all those three components, and they covered a topic like transportation or housing, little tiny topics like that. But during the presentations, there was education, but there was also polling, and there was opportunity for feedback from folks. So there was a lot of information that was gathered that fed the work that we did. And so there was a stakeholder advisory committee of these 35 humans from throughout the state, from different places and spaces in aging and disability, but there were also the long-term supports and services subcommittee, bless you, and there was the research subcommittee. And so we had these really incredibly smart, vested human beings who were working on these different places and spaces as well and feeding up. So all of the information was coming into us, and then we were assimilating and working on that. And what we ended up with all of that feedback, with all of the meetings, and I noticed on the California Department of Aging, they have a master plan for aging website, and they noted how many stakeholder meetings there were, long-term supports and services meetings there were. That may be the formal meetings, but there were subcommittee meetings and subcommittee meetings, and these two people, and so there was a ton of work that went into this process that was driven by stakeholder feedback experts and people from different places and spaces. So that was something that was really, I think, unique in my 19 years at Choice and Aging. Unique to this experience was just that collecting of so much feedback to develop this. And then the third is that during the process of taking all that feedback, putting together all this work, working in these 4 goal areas, we started with 4 goal areas. During this process, we as stakeholders got a very deep education in equity and ableism. So we all, or most of us, came into this as aging experts and left with a very different lens. Most of us, when the process began, were not terribly informed about ableism, racism, and the pervasive nature of intersectional barriers to living independently with dignity and community. And I bring this to you because I hope you too, as you develop the local implementation of your master plan activities, that you do what a former Assemblymember Cheryl Brown repeated to us throughout the entire process, which is you can't just sprinkle equity on the top of the plan once it's developed. Rather, it needs to be baked in. So in every thought, in every step, in every process, we're looking at ableism. We're looking at ageism. We're looking at racism. We're looking at gender identity. We're looking at intergenerational places and spaces. So there's so much that we need to consider as we think about our local adoption. So back to what we created was 800 recommendations. So that process yielded 800 recommendations in the 4 buckets. We had 4 goal areas that we were working on as the Stakeholder Advisory Committee. So 800 recommendations in the 4 buckets we submitted last October, and they went to the governor and the cabinet level work group. So then the process went to them and we were done, although we weren't done. That's a whole nother story. I can tell you that. Yeah.
Debbie, hi, it's Catherine. I don't know if it's just my screen, but I don't see the slides advancing. We're still on the first one.
That's right. They're gonna advance in just a minute. Sorry,
Okay,
this is a really long slide.
That's
But I
okay.
figured it was better to look at the slide than me. Sorry, we're almost there, I promise.
I just want to make sure everything's working. Please continue.
Yeah, we're working. Thanks for checking in. All right, so 800 recommendations, went to the cabinet level, went dark. Like we didn't see what happened after that point. What emerged from that process was a master plan for aging that had 5 buckets, not 4 buckets, and had 132 initiatives that were underneath 23 different strategies. I know that sounds complicated, but it was a lot less complicated, evidently, than our 800 plus recommendations. So sadly, the release of the master plan for aging was the day that our nation's capital was under siege. And I have so much to say about that. And I'm going to behave because Catherine and Lenore will mute me. So anyway, that's when the master plan was released. Here we are. We're in the midst of our moment. Why? Because the world has now spent a year seeing what we've known all along. We have a broken system. We gained 3 decades of life experience in the last century, and we've done precious little to plan for it. Add to that the ageism, ableism, racism, inequity, and poverty and their intersections, and you have a recipe for today's poverty pipeline, which leads to institutionalization or homelessness. And we see how these institutions operate now and how they are allowed to operate now. Next slide. So this master plan is about imploding that system. And the beauty of the timing of the master plan in this pandemic is a legislative cycle that contains 32 pieces of legislation related to the master plan. Never in my 19 years at Choice in Aging have I seen more than a piece or 2 of legislation that is truly championed for elders. Now the legislators are fighting with us, chomping at the bit to work with us to fix the system, and it's time to capitalize on that. That means advocacy, advocacy, advocacy. Our partners, the California Collaborative and Justice in Aging, both have pages on their websites where you can easily navigate the 32 pieces of legislation, and they're tied to each of the 5 goal areas. So Chelsea is going to show us that now. She's invisible, but trust me, she's back there. So this is the landing page that you can land on for the California Collaborative for Long-Term Supports and Services. It lists the 5 bold goals. You can click on any one of those bold goals, and you can go to all of the underlying legislation related to that bold goal. So each of those 5 bold goals have different numbers of legislations underneath them. So if you click on the first one, the second one, the third one, it might be my computer is not, I'm not seeing the landing page, but in real life, when you're not on Zoom presenting in the middle of a webinar, it works. So try it at home. But you can go there and click on it, and trust me, in real life, as I said, it works. So you would be able to see what different legislation falls under each of those categories. So back to, oh, there you are. Now you can see the underlying all the bills for each one of those 5 bold goals. You can click on those. So we're going to go back to the presentation. You guys get the picture, right? So we'll go back to the presentation. So let's have a look at the 5 bold goals. Next slide. And because I wouldn't be me if I didn't point out something badly bold, I will walk you through a mostly positive story of cheerleading about our blueprint for the master plan for aging. So something y'all know, but bears mentioning, is there's no way that 5 goals could cover the myriad of places and spaces that need thinking, planning, and investment in our California for All aging infrastructure. So these 5 bold goals are a little bit catch-all, and the names can be misleading, not purposely, but just like there's a lot tucked under that blanket. So think of it like this. The menu says soup of the day is chicken noodle. Yum! Chicken noodle. You get your soup and it's chicken noodle soup, indeed, but there's also carrots and onions and parsnip and celery and parsley. None of those were in the title, but they were necessary parts of making that the best bowl of chicken noodle soup you ever did have. So think about it like that. So the first I will go through the 5 bold goals, and then I'll talk a little bit about the carrots, onions, parsnips, celery, and parsley in each one of them. Next slide. So the 5 bold goals, oh, sorry, I made you go too soon on the next slide. Thank you, Chelsea, for reading my mind and not listening to my words. So the 5 bold goals, the chicken noodle soup, are housing for all ages and stages, health reimagined, inclusion and equity, not isolation, caregiving that works, and affording aging. So those are the 5 bold goals. Sound great, right? But what about transportation, workforce development, emergency preparedness, dementia-friendly places and spaces, and the rest of the veggies? Well, here they come. Now it's the next slide, Chelsea, thanks. So first, I want to note that all of this information on the master plan for aging can be found on mpa.aging.ca.gov. That is the website dedicated that the California Department of Aging set up that is dedicated to the master plan for aging. And I'm sure somebody can put it in the chat. It is a site exclusively dedicated to this, and it has the data dashboard, which I'm not going to get into today, but let me just tell you, service providers, advocates, stakeholders, and the rest of the entire population of California that cares about aging is thrilled that we have a data dashboard. It's a great start. It's not done. It needs more information. It needs to be broader. We need to target more things, but it is a phenomenal start. So back to our bold goals. So bold goal is first bold goal is housing for all ages and stages. That's pretty self-explanatory, right? Now, what about all the other stuff you see in the margins on this slide? They fall under this bold goal. So if you were to go to the website that I just mentioned and look at the actual master plan, you would find the following areas of priorities under that first goal. You would find emergency preparedness and response, which is a huge topic, especially in California and especially with fire season upon us. Transportation beyond cars. I'm gonna go off a little bit on this in just a minute. This was that badly bold place that I talked about, and I'll give you a little more information on that. The next is climate-friendly aging, and hello, yes, we care about being good stewards of our planet as we age. And finally, outdoor community spaces for all ages. So think communities built for intergenerational living. Think of wheelchairs on beaches. Think about rollable pathways. Think about dementia-friendly communities. Think about all of that. So dream big. So let's talk about that gorilla for a minute, that transportation. In my 19 years at Choice in Aging, this is the one determinant of independence that has seen zero change. 5 decades of studies on accessible transportation for the disabled and elders, and we have nothing to show for changing according to everything the studies said we should have done. That is the landscape in transportation. Those of us who provide it do so because in our service delivery system, we see the pervasive inaccessibility, and we see people end up in institutions who otherwise do not need to be because they don't have transportation that's accessible, affordable, available, all of these things. And in the master planning process, we lost this battle. I personally worked with a local transportation expert and spent hundreds of hours developing the transportation piece of the master plan. It is the only part of the master plan the stakeholder advisory committee worked on that was completely discarded and replaced with something entirely meaningless. I know, harsh words. Catherine and Lenore, don't get too upset with me. I'm going to go positive in just a minute, I promise. So rather than lament about this for the rest of the day, I will challenge you to get involved. Advocate, be a voice, join your local paratransit coordinating council, go to the California Transportation Commission meetings, reach out to your elected officials, email me and ask to be added to our transportation advocacy group, and do all the things, all the days of all the years until this has changed. How will you know when we have arrived at true accessibility? When the system is built around the local needs currently. We have to figure out how to fix the system. Imagine every person who cannot take fixed route or drive their own vehicle can get where they want, when they want, and then you will know we have arrived. So back to those bold goals. The rest are brilliant and they're pretty self-explanatory. I went over them a little bit. Today's breakout sessions are going to cover 4 of the 5 bold goals, 1, 2, 4, and 5. And your presentations and discussions will center around certain aspects of these goals. But I want you to know there is so much more work to do today is your start in crafting your local master plan implementation. But please, please, please don't forget the parsnips or carrots or onions. You get the picture. So next bold goal is health reimagined. Again, we tend to think of health as healthcare, and we tend to think healthcare systems. There is so much more than health as a system. It is an indicator of quality of life. It includes our friendships, our spiritual health, our nutrition, our outdoor recreation, our social connection, like everything comprises our health. And so in this bold goal area, the strategies addressed bridging healthcare with home. So we need to be able to have healthcare in our communities, geriatric care expansion, healthcare as we age, dementia in focus, lifelong healthy aging, nursing home innovation. Next slide. So this slide is inclusion and equity. This is our third bold goal, not isolation. It's the one bold goal that doesn't have a breakout session today, but like a former Assembly member Cheryl Brown said, you need to bake it in. So hopefully you think about this theme as you navigate the other 4 bold goals, but it will certainly beg much work for the future as you see what it all includes. So in this bold goal, we've got inclusion and equity in aging, protection from abuse, neglect, and exploitation, closing the digital divide, opportunity to volunteer and engage across generations, opportunities to work, California leadership in aging. So as you can see, there's a heck of a lot to unpack, and there's probably not time. So it's a good thing that's not a breakout session today, but it's work for the future. Next slide. So caregiving that works. What a heady thought, right? Again, caregivers cover so much: informal, formal, workforce, respite, education, support, caring for the caregiver, and so much more. Such a key component of living independently in the community. So in this bold goal, you will see families and friends caregiving support, good caregiving jobs creation, hello, and virtual care expansion. Next slide. Finally, we have affording aging. What? Who can afford aging? Hopefully all of us. This very large, bold goal includes ending homelessness for older adults, income security as we age, and protection from poverty and hunger. When I see this bold goal, I think of justice and aging. They are doing so much work in this place and space, and they do a tremendous job of advocating and educating all of us. Check out their website and get ready to learn and engage. Next slide. So finally, I want to thank Catherine and Lenore, On Lok and CEI, for creating this amazing platform to learn and plan together. And now we're going to launch into breakout sessions where you will begin learning about amazing and innovative things that are happening in our local communities and dreaming out loud about what will be when we all do the work of implementing the master plan for aging. So get your creative brains on, get your sponges out to absorb everything you're about to hear from some really innovative leaders in our communities. And let's dive in and work together in creating a California where we can all truly age with dignity and independence in the setting of our choice with the support we need to do so.
Thank you so much, Debbie. Big virtual round of applause for Debbie. Thank you so much for your time, for your leadership, for your energy. We are now ready to move into breakout sessions now that we have kind of a long view of how did we get here and how do we figure out where we go next, but also what does this mean for the North Bay, and what does this mean for Marin and Napa and Solano and Sonoma counties, and how do we mobilize these communities to really make to have that local impact for the master plan for aging. So we're going to move into the breakout sessions. In a moment, everyone will see a pop-up on your screen asking you to select a breakout session. You will have 4 to choose from, and so just select the session that you want to go to and you'll automatically be sent there. We've built in about 10 minutes or so of a cushion time to allow everyone to get into the breakout room, get settled before we get started. Many of the speakers have been pre-assigned to your breakout session, but for the speakers, if you are not automatically assigned to your room, just please select it. If you need help selecting a breakout session, please just stay where you are, and we will help you after the majority of the attendees have left the main room.
Hi, everybody. I hope that the breakout sessions were productive and you learned some things and maybe have some more questions to ask. And And hopefully you'll be able to have an opportunity to reach out to our speakers after the session, and we'll be providing recordings and other information that took place during those breakout sessions for you. But right now, to welcome us back, we have some pre-recorded messages from two of our legislators, Senator Mike Mcguire and also Senator Bill Dodd.
Hi, everybody. How you doing? This is Mike Mcguire, State Senator, and I wanted to welcome you back from your breakout rooms. Hey, you living the dream with Zoom or what? Thank you so much for allowing me to be part of this critical conversation on the Master Plan for Aging. I just want to say that the work that you're doing each and every day, it's remarkable. Nothing is going to be accomplished in this state without the bold leadership that you bring forward each and every day in your community. And here's what we know. Your work, it's more important than ever. 10 years from now, the Golden State, it's going to be home to nearly 11 million folks over the age of 60. That's nearly twice as many folks as 2010. And we Californians, we're living longer than ever before. And what we know is we need to move quickly to meet the needs of older adults. And the master plan, it's going to be a blueprint for success for tens of millions of our neighbors in the decades to come in every corner of the Golden State. Again, thank you so much for the wonderful work. I look forward to our partnership in the months and years to come.
One more video.
Good afternoon, and welcome back from your breakout session. I'm State Senator Bill Dodd, and I'm really grateful to be joining you for this important forum, even if it is virtually. This forum is a great opportunity to learn about the important work being done to advance the Master Plan on Aging, both at the state level and right here in the North Bay. It's encouraging to see an administration under Governor Newsom that is prioritizing senior issues, and my colleagues and I have seized this opportunity to advance that important policy goals contained in our Master Plan for Aging. This past year has been a tough one for everyone, and as you all know, COVID-19 disproportionately affected older adults, especially those living in congregate settings like skilled nursing facilities. That's why I again focused my legislation this year on supporting seniors and introduce a bill that builds upon my work last year, providing much needed flexibility to the California Community Transitions Program that provides transition services to seniors and people with disabilities who want to return to living in a community-based setting. This program helps to realize one of the foundational goals in the master plan, ensuring we provide access to the services people need to live at home in our communities and to optimize the health and quality of life. Some of you may have heard me say that we as legislators are often known as jack of all trades and masters of none. But it's only through the expertise and knowledge from amazing advocates like all of you that we are able to advance policies that bring the kind of transformational change needed to ensure we all have the opportunity to age in place with dignity and choice. And for that reason, I want to take a moment to thank all of you for taking time out of your everyday work to host this important forum for our community members. I hope you enjoy the rest of your breakout sessions. Thank you very much for having me with you today.
It's now my pleasure to introduce Nicole Howell, who can speak very directly about congregate settings and keeping people safe in nursing homes. And in alternate care settings. Nicole is the Executive Director for Ombudsman Services of Contra Costa, Solano, and Alameda counties. And she's responsible for serving 29,000 residents who are living in long-term care facilities, ensuring that they have access to the highest level of care, respect, and above all, are able to live independently and avoid abuse and neglect. when she's not working, she's also a big fan of the Oakland A's, and we hope they stay there here in our community. Woohoo! Nicole, I'm going to hand it off to you. Thanks.
Thank you, Lenore, and I say a wholehearted go A's. I want to thank all of you for making the time to be here today and to really dig into what the Master Plan on Aging could mean for the North Bay community. I want to thank all of our facilitators and our panelists, and I appreciate all the good work you have done over the last few months. And I know that we can't be in 4 different Zoom rooms at the same time, so we are going to take this time to come together to sort of have little report outs so we can learn a bit about what other people have been working on and what they discussed in their groups. So I'm going to start out with housing for all ages and stages. Can I get my facilitator from that room to come forward and share your report out? There may be some time to react to this, so if you have questions or comments, you can feel free to drop those into the chat.
Thank you. I'm Jerry Lalondeberg. I am reporting on the Housing for All Ages and Stages segment. I'm going to try to summarize a large conversation, but thanks, first of all, to the people who actually put the master plan together. I encourage everyone who is on this call to seriously study the work that brought this to you. It's so deep in what was done and the efforts that were made. In the 5 goals, the first listed goal is housing for all ages and stages. And a brief look at the plan shows that there's about 11 major initiatives, which include such things as bolstering production, providing tax credits, and prioritizing the types of housing units, advancing fair housing and equity by conducting outreach, education, and surveys, as well as prosecuting violations of anti-housing discrimination laws, reviewing housing planning and data indicators, assessing the feasibility of expanding adult family home models, exploring housing options with housing for all, and linking it to what Medicare may be able to help to provide the resources for, enhancing technology and housing, and initiative 11, housing modifications. Our group was facilitated by C.B. Wall, who's the Community Innovation Planner for Sonoma County Human Services Department, Adult and Aging. To summarize the phrase in her introduction, this is about living where we choose. Just as simple as all that. Our first presenter was Linda Jackson, who is the program director for the Marine Aging Action Initiative. Linda has over 35 years of experience in civic and leadership and project management. The Aging Action Initiative in Marine is a collective of over 65 different agencies, grassroots organizations, commissions, and neighborhood groups who are collaborating. Linda reported for us on the housing element, and it's something that we should all be paying attention to over the course, particularly the next 2 years, because it gets into technicalities of the general plan, but it also gives us a real opportunity to put into concrete the plans that the communities are going to do. Affordable housing element of the plan means that a person should only spend about 1/3 of their income on housing, but in Marin, there are 59% of the seniors who are paying more than that amount, and that's true throughout the state. The other issue that Linda raised was both the process of the planning, but also the impact that it has when people lose their housing. When people retire, they're not getting the additional income that they need. And if a partner dies, they're stuck in a place that's very uncomfortable and very difficult. The projects that are involved in the actual general plan can actually anticipate that. The source of some of what she said was the American Community Survey. We must recognize the values and the contributions of those so people can stay in their own hometown. So the elders that are in towns now who expect to be there for the next 5, 10, 20 years, you can put the plans into place as to what you need. Rachel Guinness was our second presenter, and she's the Senior Construction Project Manager for Hello Housing, their accessory dwelling unit program called Bright in Our Own Backyard. They guide homeowners through the feasibility, financing, and design, permitting, construction, and leasing of accessory dwelling units. She cited that both Marin and Napa County in terms of their leadership in funding ADUs and the county leadership. She also cited Napa's was the first to look at housing through the lens of the Human Health Initiative. If we look at the types of housing and the types of like immediate smaller projects that we could work on now, home sharing offers the most affordable housing opportunity because it can be rapidly deployed to house individuals, such as what Share Sonoma County and Covia does. We're using existing rooms in people's homes where we provide housing and generate health benefits, eliminate loneliness, and save costs. Junior units are spaces within an existing structure. Those represent an affordable, independent living opportunity from both a development and a rental perspective. Accessory dwelling units span a higher range of costs and are more resource intense. However, they still provide a new, meaningful source of sustainability, naturally occurring affordable housing in high opportunity, hard to develop communities. ADUs also act as a stabilization tool in rapidly gentrifying neighborhoods. New state laws now allow for both junior accessory units as well as ADUs to be added to single-family properties throughout California. These units are providing stable, permanent rental housing for populations hardest hit by the pandemic, including many older adults.
So Jerry, I want to thank you for all the information so far. We need to wrap this section up. So I'm curious, if you had a magic wand and you could enact one of those policies today, what is the one barrier you would need to remove to start making progress on some of the initiatives you think your group thought was really important?
I think for the allowing the law and the financial structures that address some of these smaller affordable housing opportunities, accessory dwelling units, home sharing, those kinds of things. So just the law, and then developing the support structures, particularly the case management structures that are needed to keep the glue together, because we can create the housing, but there are people who are needed to intervene.
Yeah. So not just affordable housing, but affordable housing with support services to keep folks safe and healthy and thriving in their environment.
Yeah, and I want to just point folks to the roster to look up from our agenda the other two projects that I didn't get to.
Thank you, Jerry. We appreciate your facilitation and report out. I want to remind everyone that those sessions are going to be available later on. So when you have time and you're eating lunch, please go back and check those out. I'd like to transition to Caregiving That Works. It was facilitated by Eli. He did a great job. We had two speakers. Can I have my report out team member from that group?
Yes, I believe that's me. So we had a great discussion, and really I want to prime it with, when we talk about caregiving and the caregiver workforce, we're really talking about racial equity and social justice. We're talking about a caregiver workforce that's predominantly people of color, women, large percentage immigrants, and we're talking about a workforce that lives at or below the federal poverty level. When we're doing care in the Bay Area, in the North Bay, where the cost of living is $28 an hour approximately, when we see that caregivers are on average at the national level making about $12 an hour, we are really talking about an issue of equity. While there's private pay caregivers, there's public in-home support services, and then there are folks who do both types of care, as well as family caregivers. There's clear recognition that caregiving across the spectrum is under-resourced, under-supported, and lacks a career ladder. We talked about some of the challenges navigating and accessing care during the pandemic, some of the opportunities to create a virtual infrastructure for care, some of the challenges around share of cost, and recognizing there's a large middle population of folks who don't qualify for in-home support services, but lack the resources to pay for private home health agencies. And because, as we've learned through the master plan, there are some significant fractions in our long-term care system, really needing a sustainable middle income benefit to support long-term support services, including caregiving. Finally, at the local level, we really recognize that there's an opportunity to build deeper partnerships to advocate for our caregiver workforce, for our community members, whether they're older adults or people with disabilities who need care, and to start at the local level on things like increasing the living wage ordinance, providing more workforce protections at the state level, rallying as we are the North Bay. What can we do in coalition to educate all of the Board of Supervisors for our various counties to lift up caregiver equity and give caregivers a voice? Thank you.
Eli, thank you so much. You did a great job. You're a man who wears many hats there, both the facilitator and the report out. You know, you did a great job of setting the stage of sort of the issue. I'm curious, who needs to be on that stage with you? Name a couple participants or groups that you think need to be a part of that conversation to help move this forward.
So, you know, speaking locally, we're doing some awesome work with the Aging Action Initiative, or as I like to call it, the Aging and Disability Action Initiative. But I think we really have an opportunity to do broader education of our elected officials, and an opportunity to spotlight the voice of the caregivers themselves. With the Marin Organizing Committee, we've just held 2 house forums where we've heard from caregivers directly. And while, you know, us as advocates bring a strong message, the caregivers themselves bring an even stronger one. And I think we really need to find opportunities to showcase them at the local and state level and work in coalition.
Well said. Nothing about us without us. Very true. I've added.
Oh, Nicole, you just muted.
So sorry. I've added in the chat the recent auditor's report that looks at our IHSS system and offers some possible ways forward. I'd like to move on to our group that discuss Health Reimagined. Can I have our report out from that group? Do I have anyone who wants to step
Thank
forward?
you.
Excellent.
Yeah, so sorry. I couldn't get to my unmute control. Hi. So I'm with the Alzheimer's Association of Northern California, and I'm going to be reporting out on that. So the Health Reimagined goal, the master plan for aging, is also a big area. It has 5 strategies. We focused on the first 3. So the 5 strategies are bridging healthcare with home care, healthcare as we age, geriatric care expansion, lifelong healthy aging, dementia in focus, and also nursing home innovation. So I guess that's really 6. We just chose to focus on the first 3. Our session was facilitated by my colleague, Shelley Dombrowski, the North Bay Regional Director for the Alzheimer's Association. And our panelists were Dr. Winelena Canio, who's the Chief of Geriatric Medicine and Continuing Care for Kaiser Permanente Santa Rosa, and also was a member of the Governor's Alzheimer's Task Force. Jennifer Winters, who was the project lead for Queen of the Valley Hospital's Geriatric Emergency Department accreditation and is also their Director of Major Gifts for the Queen of the Valley Foundation. And Chloe Cook from the Marin Health and Human Services Agency, Aging and Adult Services. So the basic idea that they all talked about is that California's healthcare system is not well designed or prepared for the aging of our population. One particular area of problem is that we have a severe shortage of geriatricians, both nationally and statewide. And so the primary care workforce is not trained to recognize or appropriately deal with the unique needs of older adults and people with disabilities. And people, Eli can speak better than I can to the long-standing challenges that people with disabilities have had with getting accessible and competent healthcare. So our speakers focused on innovative models for addressing those challenges, including comprehensive geriatric assessment, which has been shown to improve outcomes for frail elders, home visits by geriatric outreach teams, which have been shown to decrease mortality and reduce nursing home admissions, geriatric day hospital care, which has been associated with reduced institutionalization and death, greater independence, and higher levels of physical function. And as everyone knows, we also have this big structural disconnect between the healthcare system and the kinds of home and community-based services that many of us will need as we age to continue living safely in our own homes. So Chloe presented on Marin's Aging and Disability Resource Connection, which is a really successful model for bridging that gap and getting people the services that they need. There are links to all of these innovations on the registration page. And let me just stop there and ask you, Nicole, for your question, which I hope I'll be able to answer.
Well, Jessica, thank you. That was a really great report out. Something that sticks out to me is you talked about sort of the lack of qualified and trained geriatricians. And so I'm wondering if the group had an opportunity to discuss what, if anything, we can do in our communities to encourage, maybe young medical students to go into that sort of work, or to expand the scope of other practitioners.
Yeah. So I think that it takes 15 years to grow a geriatrician, right? And there is a structural stupidity at the federal level that only Congress can deal with, which is that people who are certified geriatricians have to do an additional year of geriatric fellowship, so more training, and then they get paid less than people who have less training. Anybody who becomes a family care physician or an internal medicine specialist has that less, one doesn't have to do that additional year of training and gets reimbursed more. So people have been familiar with how primary care physicians, family care specialists get paid lower. Geriatricians get paid least of all, especially in light of the additional complexity of their patients. So I think the state of California is spending some money on increasing geriatric fellowships, but I think it's widely understood that unless Congress deals with the underpayment through Medicare, trying to get more people to go into geriatrics is just swimming against the tide. And so what Dr. Canio really is talking about, and what all of our panelists spoke about, is that what we really need to do is figure out how to leverage the geriatric specialists we have into interdisciplinary teams and increase geriatric competency of the general healthcare workforce.
That was a lot. And I also just want to say, I see other people, the structural stupidity really resonate with them. So the first person that can put that on a shirt and drop that in the chat for us all to buy and have a little money go back to the Alzheimer's Association to support them. I'll be the first one to buy that. I wrote that down. That's amazing. I really agree with that, Jessica. Thank you for offering that and being bold.
Don't quote me.
Okay, I'm not going to say like Jessica in the, you know what I'm saying? I mean, I'm not saying what Debbie might not do on the shirt, but for me, that was great. So our last breakout group is affordable aging. Can I have my little report out person from that group come forward?
Yeah, hi, my name is Tracy Repp, and I'm a program manager for the Sonoma County Area Agency on Aging. And I just want to thank the moderator, Diane Krantz. She's a former chair from the Marin Commission on Women's Economic Security Committee, and the three speakers that we had, which are Marianne Mcbride, President and CEO of the Council on Aging in Sonoma County. And she spoke about food insecurity and innovations on food. And Elise Hempel, she's the Executive Director of Petaluma People Services Center. And she spoke about the considerations for the aging workforce and how to advocate for change. And Trin Fan, she's a senior staff attorney for Justice on Aging, and she talked about some of the impacts on the changes in Social Security. And I'll start with Trin, who spoke about Social Security. She did say that the models say that by 2060, 25% of people in the nation are going to be older adults, and we all know that many of our counties here have already reached that or exceeded that number. One of the things that was very interesting was that that these amounts of Social Security that are being given out on a monthly basis are based on eligibility requirements and criteria from 30 to 40 years ago. So the first thing that needs to be done is that needs to change. These programs need to be updated because they don't really reflect what is actually happening and what the cost of living is here and how people can manage their income as they age. They are, because of this, they're naturally restrictive. It's just really hard to live off of Social Security these days, and there's a lot of legislation that's going down the pipeline with our new administration that hopefully will make changes to this. The one thing that she said loud and clear is that what we need to do as a community is we need to look at how we, as our individual communities, what we want for today and what we want for the future, and then do our planning around that, because each individual community is very different. The next speaker was Marianne Mcbride, the CEO of Council on Aging in Sonoma County, and she talked about food insecurity. So she talked about the home delivered meals and congregate meal programs that she provides here I'm from Sonoma County. From Sonoma County, she did say that many of the recipients that she has talked to are really struggling to remain in their home, and they are choosing between food and medicine and food and heat because they're not able to make their ends meet as well. They serve about 2,000 to 3,000 people a month, and 75% of those folks say that the one meal that is delivered represents 50% of their food intake for the day. The other thing that she's seeing, that she has heard from her participants, is that the older adults are sharing their meals with their pets. So one of the programs, the innovative programs that they've started, is to partner with local feed stores. So they are delivering food for pets for a month's worth of food for pets. During COVID, there's been an increase in the need for meals. They have increased at least 30% because, especially for those that are living alone, many of them are being supported by relatives that were not able to help them during the time of COVID. So this increase has shown the real need of what people need when they don't have supports. Another innovative thing that she has started is she has provided, I'm sorry, I'm going late, aren't I? She has started drive-up pickup sites where people can come and drive through and pick up a meal pack of 5 to 7 meals. And they are focusing on providing those meals in the neighborhoods where help is needed, as opposed to having people come to a congregate meal site that may not have, it may not be accessible to those folks. So it's really highlighting the need to be able to do and deliver meals in a different way and meet the people where they are and serve them in that manner. She also said that during the fires, and unfortunately Sonoma County has had our fair share of fires, that services can be interrupted as well. And they're doing scenario planning to meet the needs depending on whatever the emergency is, but especially during fire season starting earlier and lasting longer. And so they are looking to deliver shelf-stable meals to meet that need, especially if their staff or their kitchen is disrupted in creating the meals. So that is another innovative approach that they're doing. They also rent out their industrial kitchen, and they also are selling some of their food as a gourmet meals, and that also brings in additional revenue for them. And she just ended with saying that food is important to the quality of life. And then the last person that spoke is Elise Hempel, and what she was saying is that she thinks of employment as two different types of employment. One is life enhancing for people that actually want to get out, socialize, be with, having intergenerational connections, being with people, liking the work that they do, and just like the connection. And then the other is the life sustaining, which generally is people that are low income, that have to work because they don't have options. And a lot of times they have their own barriers because they may be caregivers themselves and they may not have transportation, which is also a barrier. Let's see here. She praised the master plan for aging, which we all do, saying that this is giving all of us a starting point to launch off and just kind of focus and reframe how we address what employment might look like. And she was saying that we as a community should focus on talking to the employers to talk about how they can be more flexible. Maybe they could do flex schedules with 2 or 3 hour times of work schedules, or more part-time.
Tracy, thank you for this report. I want to get a chance to make sure we get to ask you a question. And remember, we're going to have questions from the chat also. So I'm wondering, of all of the solutions that you heard, is there one that you feel like is really strong and we all should be sure to hear?
Well, I think as we all age, we all are going to be on Social Security. So getting those Social Security benefits increased and be in line with what the cost of living actually is, and get rid of the inherent barriers that are precluding people from getting Social Security. There was also talk about immigration, documented and non-documented folks. A lot of it starts there, and also just, well, it's income and also employment, and getting people to feel a little bit more safe about how what does their retirement look like? Do they have a retirement plan? And talking to employers and maybe incentivizing employers to get in this conversation too, just to keep the income level there so people can age in place.
Thank you so much. So guys, you are not off the hook yet, because we are asking folks to drop their questions into the chat, and we're going to get a chance to have a little bit more of in-depth conversation. So I wanted to go back to something that someone said earlier in the chat, and Jerry, this is to you. So can you talk about a little bit of how we as providers and we as communities should be addressing older adults who are also homeless? Did your group talk about that at all, or offer any insights into that?
We didn't talk specifically about homelessness. Our last presenter talked about dementia and those issues in their services that they're providing in Napa County. I would simply point everyone to the parallel state plan that's been developed. There's an action plan for homelessness that was just put out by the state homeless council and finance committee. It dovetails, in my opinion, completely with the master plan on aging. I think we can identify places where people have lost their housing, identify matching and sharing programs that could be in place. It's or like topical in Sonoma County today is that the county is going to lease a hotel in Windsor for people over the age of 65 who are affected by COVID under the non-congregate shelter site. So it's another long presentation when we get to that.
It seems to me that there's an opportunity here with Project Room Key, that we've put people in housing rather than end that. Let's keep them there and provide those great supported services that you mentioned in your earlier report out, that this is a real opportunity to invest. We've already invested. Let's just keep that going to keep folks housed and safe.
And each county has to think about that because that's all locally controlled.
Good point. So, I work in Solano County, and so people talk a lot about, facilities that will take SSI, and what I call those are just unlicensed facilities in our community. So it seems to me that we could work together collaboratively to really find some shared solutions. Gwendolyn Gill from Solano County had a great question, so I'm going to throw it out to anyone. So just let me know if you'd like to answer. And she writes, how can Board of Supervisors and City Councils best be informed about the Master Plan on Aging? How can they know? Is there an outreach effort from Sacramento and the Master Plan on Aging team? How can they best really stay up to date on what is going on and how they can be creative in their communities?
I'll take a stab. This is Eli. And, really, if you have a local coalition, whether it's aging and disability, workforce, set up meetings, educate, have one-on-one sessions with your Board of Supervisors, bring in providers, have your talking points, educate the Board of Supervisors about the local services being offered in the community, especially during the pandemic. A lot of incredible work has happened with public health departments, with vaccine rollout, with supporting, our caregivers, and those stories need to be shared. I think there's many talking points that could be developed, but at a very basic level, it comes down to advocacy and building that local grassroots network.
Does anyone else want to jump in with anything that their sort of breakout groups discussed? I wonder if there's also sort of staking a claim in the ground. I know in Contra Costa County, the Board of Supervisors said that aging and building a healthy aging community was one of their platforms, and they were going to work towards that. If each Board of Supervisors said, hey, this is important to us, it already takes a sort of a really assertive approach that aging and older adults and adults who experience disabilities are important to them, and they're committed to embracing and exploring policies that create safer communities for all. And so I would say, Gwendolyn, I really support the idea of, Advisory Council on Aging and others really lobbying their Board of Supervisors and saying, this is what we want to see from you. This is an important group of folks who live in our community. In the Caregiving That Work groups, Eli, we talked a little about sort of those frontline caregivers and the folks who are working IHSS, doing sort of outcall and in facilities. But Jessica, I know in your group, you talked about, again, geriatricians, so that sort of higher end on the spectrum. I'm wondering if anyone discussed the idea of those additional support staff who we could really develop a workforce pipeline for. So did anyone talk about the need for MSW students who are interested in working with older adult population or others that we really need to fill this critical need?
Yeah, Chloe talked about that. She has built partnerships with all of the colleges in her area in Marin and meets weekly with the chairs or the academic heads of the health workforce departments at those colleges and works directly with them on recruiting the social workers and other people and particularly with an eye to making sure that their workforce reflects the diversity, language, background of Marin.
Oh, so true. I wonder if maybe you talked about different organizations, because I think so much maybe it's just the aging community, but so much of it are nonprofits who are delivering these services that we in our own organizations could consider launching MSW internship programs or even bachelor's of social work programs to get young folks interested in working in this field. They add so much to your organization, both language, understanding, increased diversity of opinion and life experience. I would love for folks to be talking about that and how can we offer them stipends. Eli mentioned in our breakout session talking about why these are equity issues. If we have young students who are in school who are BIPOC folks, more likely to be working, more likely to be first generation college students, we need to find ways for them to engage professionally and have supports for that. Yeah, Eli.
One thing we're cultivating, and it's still early in development. But even at a very basic level for caregivers or family caregivers, moving from informal or IHSS caregiver to CNA certification. And that is a program that could be offered at the community college level. And then, taking that CNA certification and moving to the next level, LVN, and then to RN, being very intentional and working with our local community colleges in developing some basic curriculum that could be offered to young people, or for family caregivers, maybe in a second or third career. But there's opportunities there that we could be exploring.
And
I
I would
also
add
add
to
adult
that,
schools to that as well, community college and adult schools. I'm sorry, Jessica, what was that?
well, I was just going to add to that, that Cal State is very proud of the fact that they are the greatest source of nursing students and other allied health professionals in California. And it would be good, instead of each of us having to try to build these relationships individually with departments, which is brilliant when you can get it, and it's also quite time consuming to initiate, if we could figure out a way to have a higher level partnership with all of these health professions training programs.
Can I just put a plug in for the healthcare career pathway? Slides 34 and 35, local playbook master plan. Thanks, guys. This is great conversation. I'm curious, you all have worked in this industry a very long time and have been on the front lines for us. So I'm curious, who are you looking to as your mentors, your heroes? Who are you following on Twitter and Instagram who are talking about aging and ableism and disability rights?
Well, I follow Debbie Toth and Christina Mills. I also follow the SCAN Foundation, which, underwrote this event, and it's just been really smart and really strategic in building the coalitions that we have right now doing this work.
Mm-hmm.
I also follow Christina Mills. For those that don't know, my wife. But I also want to highlight some amazing advocates. Alice Wong, at SF Direwolf, incredible. Valissa Thompson, incredible advocate. There are some really dynamic and kind of younger generational voices. That doesn't mean my wife is old, but younger generational voices that I think we could follow too. Highly recommend both of those.
Tracy and Jerry, what about you? Who's inspiring you these days? I think you're on mute, Tracy.
Yeah. I think that we, in terms of the spaces, I'm looking more at the intersectionality of spaces as well as the conversations that are going on, paying close attention to those in the homeless space and in the place where folks are elders, trying to figure out how to create that respect and the communication. So I want to call out in the master plan the work that Dave Lindeman and those folks are doing with technology at UC Berkeley, and also want to look like even Gregory Farron is on this call, and his leadership in terms of homelessness and housing and trying to get the housing dollars that are flowing into California to be adequately used and transparently used. So I'm basically most concerned with the bottom 20% of the income sector, which is folks on SSI, folks on Social Security, folks with disability, that we create the legislation and also the awareness that that's where we need to pay attention to, and that's where they have such a hard time with the RENA numbers and the housing numbers to get the right kind of affordable housing. So obviously following Housing California and some of the national bodies as well.
Tracy, what about you?
Well, I'm really inspired by all of the committee work and everyone that's on this call, especially those that are doing the committee work for the master plan for aging. I'm inspired by that our governor has finally risen this up, and I'm inspired by Kim McCoy-Wade, the California Department of Aging director as well, because that is a priority for her as well. And I'm really inspired, which totally intersects with the master plan for aging, is the age-friendly initiative, and how important that is for all of the counties and the country to embrace that, because that is interwoven through all of the master plan for aging, and it addresses all of these issues. And if we can all come together and create an age-friendly, dementia-friendly community, then we will all be better off.
Yeah. Want to highlight for folks, we've dropped a couple important links in the chat, and encourage you to go click on those and save those for you to look at later. I'm going to close out, perhaps because I'm an ombudsman, I'm going to pick this question from the chat. Molly writes, did anyone talk about the expansion of the assisted living waiver program, which it essentially would allow Medi-Cal dollars to pay for a lower, less institutionalized level of care? And really, we saw during COVID that folks who were in skilled nursing, that was a lethal place to live. And really the only difference in my experience from folks who are in skilled nursing and RCFE oftentimes is simply their ability to pay, or if there's someone who's a Medi-Cal recipient. And so question, as we close out, did anyone talk about expanding that program or different ways that we can pay for long-term supportive services in a congregate care setting?
We did not specifically talk about the assisted living waiver. We did talk about the large middle income, the Californians who don't qualify per Medi-Cal and in-home support services that can't afford private home health care. And, you know, there was a big push, and many of the advocates on this call with the California Aging and Disability Alliance, to create a long-term middle income benefit. And that fight must continue until we have a long-term services and support daily benefit that folks can use to pay for, whether it's caregiving, home modifications, assistive technology, all of the, you know, and service coordination, all of the services and supports it takes to live at home. We're going to be in this cycle of institutionalization or spending down into poverty, which is just not sustainable, especially for a state of 40+ million.
Absolutely. Anyone else have some thoughts on that? Tracy, yeah.
Yeah, I just want to say, speaking for Sonoma County, we have one agency that does the assisted living waiver, and I talked to the owner of that yesterday, and he said that he is very encouraged because he has been able to expand the assisted living waiver beds at his particular location from, I think, 6 to 12, and he wants to expand more. And I asked him, I said, how's that going? How's the money flowing? Because that has been a barrier in getting the reimbursement. And he said the money is flowing. So that, I feel, is super encouraging, and it may be something that can be broadcast to say, this is working. People are getting the reimbursement for providing assisted living waivers. So just wanted to share that.
That is great to hear. It's not a program that the Alzheimer's Association has been able to use very much. And it's not something that we discussed in full in our discussion, although I'm sure Chloe's the ADRC absolutely connects people with it. And also, we did learn in the course of our breakout that Sonoma County is in the process of getting approval for an aging and disability resource connection, which is great news for the North Bay.
Congrats to them. Jerry, did you have any closing thoughts on the assisted living waiver program?
Well, tangential to that, as a board member of Share Sonoma County, I recognize that shared housing and bringing people together where there's an extra bedroom is a natural form of that, where you're forming, help, you're keeping people in their homes, you're not allowing them to deteriorate. So it's the click above that waiver is keeping people in their homes with some sort of a shared housing where it's moderated. But the issue there that we're looking for is we need case management dollars, because those situations always change, and we need to be present to go back into situations to sustain them. So thank you.
And can I just, you saw that. Just going back to the advocacy piece, I just want to encourage people to think a lot about state legislators. I think our state legislators are really even more than county supervisors. They are holding the purse strings. There's a $54 billion state budget surplus this year. All of these things need the state to increase the investment in implementing the MPA recommendations, beefing up the capacity of the state agencies that are supposed to be working on these things through Department of Public Health, Department of Aging, Department of Social Services. And this is the time for all of us to be pushing our advocates to be advocating for that with our state legislators.
Well said. Well, I want to thank all of our group facilitators, our speakers, as well as our report out group here. Thank you so much for taking the time today to offer your information and expertise. I want to remind everyone that we have some important resources in the chat, and we're going to go ahead and I'm going to pass it back to, is it Catherine or is it Lenore? I'm sorry, I didn't take strong enough notes.
It would be me. It's
Oh, there we go, Lenore.
Yay. Well, thanks very much, Nicole. Thank you, everybody. These report outs are, sometimes it's hard to distill what happens during all those big exchanges, but I think you really brought essential information back to all of us to think about more. And the chat has got a lot of great resources in it, so we'll make sure that those are available to you too. We're going to be sending out an event survey to you as well. It would be very helpful. We mentioned earlier that these master plan on aging events will be taking place across the state, and the coalition that we belong to would be very interested to hear your comments and all, and share feedback, so that we can make these as effective as this one has been. So thanks and congratulations, everybody. Catherine?
Thank you, Lenore. Just some final closeout comments. So we will also be emailing links of the recordings from today and the speaker presentations to all of you. And we really do hope that you'll share what you learned and discussed today with the leaders in your community. We will be sharing this rich discussion and recommendations with the SCAN Foundation, California Collaborative for Long-Term Services and Supports, and the state leaders who are working to implement the Master Plan for Aging. We also invite you to follow the Bay Area Senior Health Policy Forum on Facebook and LinkedIn and our website. You can also join our mailing list to find out about additional events that we will be hosting. Elevating your voice and the local innovations from Marin and Napa, Solano, and Sonoma counties is absolutely critical to developing a truly impactful master plan for aging. And we will be in touch regarding additional opportunities for how you can stay engaged. We are so grateful for your time, participation, and input today. Thank you, everyone, and be well.
Yeah, congratulations, everybody. Great job.
Thank you.
Mm-hmm.